Hello guys, in the last lecture I already discussed about the white matter. In white matter there are three fibers present. One is the association fiber, the one which connect the anterior to posterior. Anterior to posterior. And the second one is the commissural fiber. Commissural fiber are those which connect the right hemisphere to the left hemisphere. And third one is the projection fiber. Projection fiber are those which connect the brain to spinal cord up and down. And I already discussed about the commissural fiber in detail and as well as association fiber. And projection fiber are those projection fiber are further classified into the corona radiata, internal capsule and tracts. In tracts, one is the descending tracts and one is the ascending tracts. In descending tracts, always there is motor neuron, and ascending tracts there is always sensory neuron. So I already discussed about the descending tracts in detail. Now I am going to talk about the ascending tracts. So let's suppose this is the cross section of spinal cord. This is the dorsal tracts and this is the lateral tracts, and this one is the ventral tracts. In dorsal tracts there is only ascending tracts, and in lateral tracts there is ascending tract as well as descending tracts. And ventral tracts there is also present ascending tract as well as descending tracts. So this is the dorsal horn of gray matter. This is the central canal, and this is the anterior horn of gray matter, and this one is the lateral horn. So let's talk about these tracts, ascending tracts. In dorsal tract there is two tracts present. One is the fasciculus gracilis and next one is the fasciculus cuneatus. So from where fasciculus cuneatus and fasciculus gracilis come? From the lower limbs. Fasciculus gracilis come out from the lower limbs and fasciculus cuneatus come out from the upper limb. On lateral side there is one present, this one. This is called spinothalamic tracts. Lateral spinothalamic tracts present on lateral side, that's why it is called lateral, and come from the spinal cord and go up to the thalamus. That's why it is called spinothalamic tracts. And this one is present in anterior, that's why it is called anterior spinothalamic tracts. This one is also come from the spinal cord and go up to the thalamus. That's why it is called anterior spinothalamic tract. On lateral side, one more spinocerebellar tracts, but they are present. One is present on dorsal side, one is present on lateral side. That's why one is called dorsal spinocerebellar tracts, and next one is called lateral spinocerebellar tracts. So these all are about the ascending tracts. Now I am going to talk one by one in detail. But before going to talk one by one of these ascending tracts, first of all I would like to share the basic function of these ascending tracts. So first of all, these are our ascending tracts. So ascending tracts will always carry the sensory information, and sensory information will be like pain, temperature, pressure, etc. But you must know which tracts carry the exact information. So let's start. Fasciculus gracilis and fasciculus cuneatus. They carry the fine touch, vibration, stereognosis. So what is stereognosis? The ability to identify any object just by touching without any help of eyes, visual. So that is called stereognosis. And fourth one is the proprioception. So which one proprioception? Conscious or unconscious? So fasciculus gracilis and fasciculus cuneatus, they feel the conscious proprioception. So what is the function of spinocerebellar tracts? Dorsal and lateral spinocerebellar tracts, the function of this one is the proprioception, but this one is the unconscious. And this one, lateral spinothalamic tracts, they feel the pain, temperature like this. And this one is the anterior spinothalamic tract, they feel the touch, but which one touch? Crude touch and pressure. So this all about the basic function of these ascending tracts. So let's start one by one. Fasciculus gracilis and fasciculus cuneatus. I will talk it later, but first of all, I start from the spinothalamic tract. So spinothalamic tracts have two: lateral spinothalamic tracts and anterior spinothalamic tracts. So all the sensory information, pain, temperature, crude touch, pressure, all are going to be sensory nerves like this. This is the sensory nerves, and this one is the dorsal root ganglion. After dorsal root ganglion, sensory nerves are going to be in here. So this is very important place, junction. This is called substantia gelatinosa. And after substantia gelatinosa, from this junction, substantia gelatinosa, one nerve are going to be laterally. So after this one, they are going to ascending. So this one is called lateral spinothalamic tracts, and from this junction, one nerve are going to anteriorly. So obviously this is called anterior spinothalamic tracts. So as lateral spinothalamic tracts and anterior spinothalamic tracts, as they enter to medulla oblongata, directly this name change into spinal lemniscus and joining medial lemniscus. So what is lemniscus? Lemniscus refer to a bundle of nerve fibers, especially white fiber in the brain stem. So this name change into spinal lemniscus, and they go up to thalamus. So here one more most important question: where the spinal lemniscus and medial lemniscus are joined into where? The answer is the VPL, ventral posterolateral nucleus. They both are joining here. So from the VPL nucleus, all information will go up to sensory cortex, area number 312, this place. And this fiber is called thalamic radiation. One more important thing that I would like to mention here, that is the first order neuron, second order neuron, and third order neuron. So let me to show you. First of all, dorsal root ganglion. This is the place first order neuron, and this neuron will be in here, in the place of substantia gelatinosa. And second order neuron, this one. This is the place of second order neuron, and this is the place of third order neuron, thalamic radiation. So this are about the order neuron. One more important things that I would like to share here. So what is substantia gelatinosa? Substantia gelatinosa is the place where decided that pain and temperature will be go to laterally or anteriorly. If there is pain and temperature, they will be going to laterally. Where is the crude touch, pressure will be going to the anterior. So guys, let's talk about the dorsal column tract. Dorsal column tract, as we know that they have two tracts, fasciculus gracilis and fasciculus cuneatus. For example, from lower limb, sensory nerves are going to, this one is the obviously dorsal root ganglion, and from dorsal root ganglion, sensory nerves are going to directly dorsal white tracts and go up to medulla oblongata. So this is called fasciculus gracilis. If this one is the lower limb, so This one is the upper limb. From the upper limb, sensory nerves are going to dorsal tracts and go up to medulla oblongata. So this one is called fasciculus cuneatus. Fasciculus gracilis and fasciculus cuneatus, they both enter to, one is going to gracilis nucleus, and fasciculus cuneatus go into the cuneatus nucleus. After this, they both turn into the like this. This is called medial lemniscus. Why it is called lemniscus? Because it is present on the brain stem. So they both go into and enter into the thalamus VPL nucleus. So this fiber that are cross the medulla oblongata, this is called internal arcuate fibers, like this. And after VPL nucleus, all sensory information go up to the sensory cortex area number 312. So, and this one is called thalamic radiation. This place is called thalamic radiation, like I already discussed previously. So some certain fibers are going downward, like this. This is the cuneatus, fasciculus cuneatus, and this one is the fasciculus gracilis. From there, certain fibers are downward, and in here this this nucleus. This nucleus is called nucleus proprius. From the nucleus proprius, fibers are downwards and go to the lower motor nerve. So let's talk about the spinocerebellar tracts. So spinocerebellar tracts, as we know that spinocerebellar tracts have two of them. One is dorsal and one is ventral. So this is the cross section of spinal cord. This one is the dorsal spinocerebellar tracts, and this one is the ventral spinocerebellar tracts. Spinocerebellar tracts are sensory nerves, so they enter into the dorsal horn of gray matter, like this dorsal root ganglion, and they enter to the, this nucleus is called nucleus dorsalis because they are very near to the dorsal horn, so that's why it is called dorsal nucleus dorsalis or Clark's column. From this nucleus, one spinal nerves are going to ventral, so this is called ventral spinocerebellar tracts, and one are going to back into the dorsal side, so this one is called dorsal spinocerebellar tracts. Ventral spinocerebellar tracts are going up to the superior cerebral peduncles. They enter to the cerebellum, and dorsal spinocerebellar tracts are going to the inferior cerebral peduncles and go into to the cerebellum. One more important thing, that ventral spinocerebellar tracts that not only enter to the cerebellum but enter to another cell, give collateral to the other side of cerebellar. So from the upper limbs, unconscious proprioception, sensory nerves are going to the white dorsal tracts on white matter. They are going to like this and go up to the inferior cerebral peduncles. And there is one nucleus. This nucleus is called accessory cuneate nucleus, and this tract is called cuneo-cerebellar tracts. So one more thing about the clinical correlation. If injury occur here in fasciculus gracilis, so what's happened? Ipsilateral loss of conscious and proprioception from lower limb. If injury occur here, what will happen? Loss of proprioception and ipsilateral side from lower limbs. If injury occur here, fasciculus cuneatus, ipsilateral loss of conscious and unconscious proprioception from upper limb.